Hello, my name is Stacy Bido. I'm going to be doing the NG tube insertion video validation. I'm at the Thief River Falls campus, and besides my videographer, I'm the only one here, and I have no papers or anything to cue me. So I've come into work and my patient needs an NG tube as per physician's orders. I've come in and I've done a patient identifier with 2 checks. I have explained to him the procedure. I have provided privacy. I've done hand hygiene and I've gloved. So now he understands what's going to be happening, and I am coming in. I'm going to ask him a few questions to assess which nostril I should be using for the NG insertion. He's stated that he has polyps on this side, so we're going to use the left one. So the first thing I want to do is I'm going to measure. So measure from the tip of the nose to the tip of the earlobe, and then from the tip of the earlobe down to the xiphoid process. And I would use a piece of tape to indicate how far I think the tube is probably going to go. Next thing I'm going to do is I'm going to take that tube and I'm going to kind of coil it to make it a little bit easier to insert, and I'm also going to take some lube and I'm going to lube it. Okay, so now I have it lubed and we're ready to go, and my patient is ready. So I'm going to insert about 3 to 4 inches until he begins to gag. And I'm going to stop. I'm going to give him a little bit of a break, never taking my fingers off of this. And then I'm going to give him some water, and I'm going to ask him to swallow every time I insert it. So if I had an assistant, she would help me. She would hold it, or he could hold it. And so I'm going to ask him to swallow every time I insert it. So peristalsis will encourage it to go down, as well as avoiding going into the pulmonary system. So it's gone as far as it can go. So I am going to tape it. I'll tape the one side. And now I want to check for placement. So now I don't need these. So I want to check for placement. So the first thing I'm going to do is I'm going to take some 10 mils of air. And while I'm listening to the fundus, which is just to the left of the xiphoid process, I'm going to insert the air. And I should hear a swoosh. I'm going to pretend I did. And then I'm going to aspirate a little bit. And I'm going to check that fluid that I've aspirated and check the pH. It should be between 0 and 4 to confirm that it is in the stomach. Now I'm going to, so it is stomach, so awesome. So I'm going to take it. I'm going to turn the pump on, low suction, and I'm going to take a new syringe with about 5 to 10 mils of air. And this is to make sure that the tube is not lying against the stomach wall. And it isn't. So and then I would take it and I would pin it, giving him enough room that he can move his head back and forth comfortably. And I would take the other side of the tape and I would wrap it around and secure it. So there's the insertion. Now I've come back in and I've seen that it's not suctioning. There's got to be a blockage somewhere. So the first thing I'm going to do is I'm going to shut my suction off. I'm going to disconnect. I'm going to take 5 to 10 mils of air. I'm going to try to put it in to see if I can, but it won't go in. So take it, clamp it, and I'm going to get 30 cc's of water. holding it. I'm going to do a pumping action until I can unblock it. And it's gone through, it's good, it's unblocked. I'm going to connect it back to the hose. I'm going to turn my suction back on, low intermittent. I'm going to get a new syringe, 5 to 10 mils. And again, I'm going to insert some air to make sure that it's not against, the tube is not against the stomach wall. Okay, now, a few days later, I've gotten a physician's order that he wants the NG tube removed. So I'm going to come in here, and I am going to first assess all 4 quadrants of the abdomen, of the bowel, pardon me, to make sure that I can hear bowel noises. And there is. Excellent. Now I'm going to check for placement. So I'm going to get 10 cc's of air. I'm going to shut the suction off. And while I'm listening, I should hear a swoosh. I hear a swoosh. And then I'm going to aspirate. And check the pH of the the irrigation, and it's between 0 and 4, so I know it's in the stomach. I'm going to grab a new syringe. I'm going to fill it with 20 mils of water, and then followed with 20 mils of air. And I'm going to insert it to clear out the bile with the water, and then the air will clear out the water. So I've inserted there. I'm just going to leave this. And now I'm going to ask my patient to take a deep breath and hold it while I slowly remove. And he has the NG tube out. I would take this, put it in biohazard. I would chart all of the information, and